Welcome back to Talk the Walk with me, Sarah Wong. I'm now with Dr. Ben Cowling from the HKU School of Public Health. Doctor, thank you for your time. We're just talking about the quarantine rules that Hong Kong currently have in the face of the threat of the Omicron COVID variant. Now, is there any suggestion you would like to make to the Hong Kong government about our current quarantine system and the various exemptions from a public health standpoint?
Yeah, I think it is very clear that the designated quarantine hotels are good for keeping people in quarantine, but they're not perfect for keeping people in quarantine. We've seen on a handful of occasions in the past year, there has been transmission of infection from one guest in a quarantine hotel to another guest. And if that other guest is coming to the end of their stay, if they're towards the end of whether it's 14 or 21 days, if they're at the end of that, then they go into the community and then they can spread virus into the community. What we really need is a special purpose-built facility for on-arrival quarantine. Now, a year ago, if we were thinking that this policy was only going to be in place for a short time, I can understand why we wouldn't start building a facility. But now, at the end of 2021, it seems like there's no end in sight for the policy of having quarantine on arrival. So I think a purpose-built facility would be a great addition for our city, maybe 30,000, 40,000, even 50,000 rooms. And if we have a facility like that, 14 days quarantine is definitely sufficient. There's no need for any longer than 14 days. And people can plan much better if they know there's going to be rooms available, facilities available for them to stay at. Because I think people that are thinking about traveling or thinking about moving to the city, I have a couple of colleagues just recently joining and they had trouble booking their quarantine hotel so that they could move here because the supply is so tight. So it's not only about people who are here who want to travel, it's about people that want to move here. And it's not a very easy system to navigate at the moment. We don't have that many rooms available for quarantine. And the policies also keep changing from time to time. The length changes, the category changes, flights get banned and countries get banned. And so it's not so easy to plan as we hope.
Now, what will the facility that you just suggested, what would it be different from the Penny's Bay Quarantine Center that we already have? And what criteria, such as public health requirements that you have in mind that this facility will need to meet to better prevent the transmission of intra-hotel, among intra-hotel guests?
Yeah, I think Penny's Bay is pretty well constructed for this particular purpose. Each room is individual, has its own ventilation, has its own door to outside and a window that can be opened. And it's pretty easy to manage all the guests in this facility. But I think all the rooms are pretty similar. They're pretty, I would say, economy level. And that's fine. I'm not being elitist to say that's fine. And I most likely will stay in Penny's Bay. But I can imagine that some people coming to Hong Kong, if, for example, they've booked quarantine in the Mandarin Oriental or somewhere, they might hope if there was a slightly higher version of Penny's Bay that they could stay in. So maybe we could imagine an on-arrival facility that has a range of price points. Maybe we have better Wi-Fi. Maybe we have food choices and on-site kitchens and so on to look after people better. And I think that the Penny's Bay model is a pretty good model, just needs to be substantially enlarged. And then let's think about how to make it nicer. Because remember, this is also Hong Kong's face to the world. Anyone that we invite to come to Hong Kong is most likely going to go through this facility in the future. So I'd like the people that I want to recruit to Hong Kong University to be able to come into a nice facility as their first point of contact with Hong Kong. And at the moment, my two colleagues have just spent a week in Penny's Bay. And so that's their first experience of Hong Kong as someone coming to the city. Their first 7 days is in Penny's Bay. I wish it had been a nicer experience for them.
Yes, Asia World City in Penny's Bay with improved service, hopefully in the future. Now, I heard that Omicron, obviously, we know that it's heavily mutated with dozens of new mutations at its spike protein. And some experts found that, some researchers found that and thus Omicron presents different syndromes and different symptoms that's different from the previous strains, such as Delta. Now, what are the new symptoms that people should be looking out for now? And is there a significant difference? And if there is, what is causing that significant difference?
So right now, I don't think there's an awful lot of evidence that there's any major change in the presentation of symptoms with Omicron versus other variants. I think it does seem to be a little bit milder. So there's probably more people are going to test positive without any major symptoms. But still, the symptoms to look out for are fever, the dry cough, loss of smell or taste, and the symptoms becoming sometimes a little bit worse over the course of about a week, and in other people being very transient. So just feel a little bit under the weather for a few days and then feel fine. Remember, for most people, COVID is a very mild infection. It's only a minority that get really sick with it. But of course, when you have lots and lots and lots of people infected, then that minority can still also be a large number, unfortunately.
Now, apart from vaccines, we have different vaccines, and some companies are rolling out booster and even a vaccine specifically targeted for Omicron. Now, but U.S. pharmaceutical giant Pfizer, they said they also developed a COVID treatment pill that's experimental at the moment, but they said their pill can work against Omicron. Is that something in the future, if it proved, like after clinical trial, if it's proved effective, is that something that you would suggest to the Hong Kong government to add to our so-called COVID defense arsenal?
Yeah, I think there's a very exciting drug from Pfizer and also another one, I think, from Merck. So two antivirals that look like they've had successful results in their clinical trials. I am slightly concerned about Pfizer's drug, and I think the FDA are also slightly concerned because of the way it works. So the way that this particular drug works from Pfizer is to kind of scramble up the virus and make it make a lot of mistakes. So the virus makes a lot of mistakes when it's replicating itself inside the patient's body. And most of the time when a virus makes mistakes, then the virus no longer can propagate, it can no longer replicate because there's too many mistakes, it's too jumbled up. But the worry is, I think, from myself and maybe from the FDA as well, the worry is that once in a while, if you jumble up the virus, but it lands on something that actually is even better than it previously was, you've kind of helped it along its pathway of evolution, and it may end up making things worse. Now, that's a hypothesis, but it is something to be wary of. And so for Pfizer's drug specifically, I'm a little bit cautious, but for Merck's drug, that looks promising in clinical trials, and I suspect we'll hear about other antivirals in the coming months. And once we have better treatments, COVID will pose less of a threat. So we have vaccines and then hopefully treatments. That's a great combination.
Now, let's talk about China. We've touched on that earlier. Obviously, China has been adhering to the zero COVID strategy and is still sticking to it. Now, with the emergence of Omicron on Chinese soil, do you think, China has been very proud of its strategy, and it said the arrival of Omicron exactly proved that their zero COVID strategy is exactly correct. While the rest of the world open up, they keep their doors closed, and so they avoid a relatively large-scale outbreak on its soil. But do you think that it is correct, and do you think that China has a point of keeping its door shut?
Yeah, for mainland China, I think we have to think about the pros and the cons of the zero COVID strategy. In other places that use zero COVID, like Singapore, Australia, New Zealand, they very clearly saw it as a means to an end. That in the early days of the pandemic, you have the zero COVID approach. Once vaccines or antiviral drugs are available and COVID poses less of a threat, then it's time to transition away from that. And we've seen Australia, New Zealand, and Singapore transitioning away as they get higher and higher vaccine coverage. And I think that they will be satisfied with that decision. In mainland China, though, it seems even though they have a very high vaccine coverage, they're still planning to continue the zero COVID policy, at least into the medium term. It's not quite clear how long, it's not quite clear what would change the assessment of the pros and cons. So remember, the pros for zero COVID are that you don't have COVID, but the cons are that you have this very strict quarantine on people coming into the country. And also you have the necessity of very stringent control measures if there are outbreaks. And we've seen outbreaks in some cities in recent months requiring lockdowns, mass testing, and other forms of disruption. And remember that within the mainland, There's still a lot of travel restrictions. People can't easily move from one province to another. Particularly some provinces are quite strict with quarantines for people coming from other provinces. And I can imagine there's going to be disruption in the coming months, the coming year or longer, for the same reason that if there's an outbreak in one part of the country, then other provinces will shut the door to people coming from that province. And so I think for the mainland government, they have to look at the pros and cons. And at the moment, it seems like they think the pros outweigh the cons for the strategy. I would say, though, that for Hong Kong, the calculation may not be the same. The things in the pros and the things in the cons may not have the same weight as they do in the mainland.
Okay, before I let you go, Doctor, very quick, what do you think is it that the world is missing or not paying enough attention right now about Omicron and overall the COVID pandemic?
For Omicron, I think what we're missing is the lesson from the last 2 years, that you have to act quickly to stop COVID transmission. And right now, we can't only rely on vaccines. In Europe, in the United States, public health measures, some form of social distancing will be necessary to slow Omicron down. Otherwise, I think we're going to see more people in hospital with COVID than ever before. And that's really a shame 2 years into the pandemic when vaccines are widely available. So that would be my lesson, is that we have to act fast. We can't wait until hospitals are getting full up, because if you act at that point, it's going to be too late because of the lags, because of the delays from when people get infected until where they need to go to hospital with rising case numbers.
Okay, Doctor, thank you very much again for your time today. Now, Talk the Walk will return next Saturday on HKIBC. I'm Sarah Wong. See you then, and good night.